graduated from medicine in Queen's University in Belfast. Practiced medicine as a junior doctor at the Mater Hospital in Belfast, and then joined iMedicare Limited like 2 months ago, where I now work as a clinical advisor and as a medical rep. To tie in with Joe's talk today, what I'm going to do is I'm going to talk to you about vacuum constriction therapy for males who are suffering from erectile dysfunction. That can be either pre-prostatectomy or post-prostatectomy. Okay? How we treat it is with the Soma Erect vacuum pump. The vacuum pump is mechanical in nature, mechanical in a sense that it cannot fail. If it is applied and used correctly, it will always generate an erection. Okay? How it works is by a simple vacuum system. It entrains air and thereby entrains blood into the vessels within the penis, causing the fibers in the cells to stretch and strengthen. Okay? The pump comes in 3 very simple parts. The first part here is the pump head. The pump head has a lever, which you can see, and the ones here at the front. As you can hear, whenever I compress the lever, that's sucking air in through a one-way valve. Okay? The pump has an inbuilt regulator within it, which means the male patient can never overpump. Thereby, there is no risk of causing any damage to the penis. This black button here is the pressure release button, which I'll go on to show you momentarily. The second part of the pump is the cylinder. Okay? The cylinders come in various sizes depending on the size of the gentleman. The most commonly used cylinder is the C cylinder, otherwise known as the large cylinder. Okay? Whenever the gentlemen see this in the clinic, most of them want to get up and leave straight away. Jesus, I'll never fill that. But the objective isn't to try and fill the cylinder. Okay? The cylinder is mainly that size just to give the gentleman plenty of room to grow and expand. Okay? And it slots into the pump head very simply by a twist and lock mechanism. Simply slot it in and twist until it no longer separates. The third and final part then of the pump are the black rubber ring inserts. Okay? And they simply go in the end like so. Okay? Another inner ring can also be placed alongside that depending upon the girth of the gentleman. Alright? And the main objective behind that is to provide comfort for the patient and also to generate a nice tight seal. Okay? So once the seal is generated, you simply pump up, and that's what creates your vacuum. Alright? As I'm doing that, the patient here, as people here in the front row can see, the blood in my hands been sucked into the pump, and there's our vacuum. Okay? And that's released by the pressure release button. Alright? Now how it works is that we advise all gentlemen who are using it to shave their pubic hair. Okay? That helps to generate a nice tight seal. They then retract the foreskin of the penis if they're not already circumcised, and they apply a water-based lubricant to the end of the penis. Okay? All of the pumps come with a water-based lubricant, but when that runs out, simple KY jelly will suffice. The important thing to remember is that oil-based lubricants should be avoided, as they can perish the rubber rings that are used to try and maintain the erection. Okay? Some water-based lubricant is then applied to around the rubber ring at the end and also along the inside, just to aid the penis slipping inside. Okay? So if you want to imagine that my thumb is a gentleman's penis, what you simply do is slot it inside, take the index finger between the lever and the cylinder, and nice, slow, gentle compressions like so. So you're aiming for 2 to 3 compressions within a 5-second period. Okay? The reason to keeping your finger there is that it prevents any noise. Okay? Most gentlemen, whenever they buy this, are a little bit conscious. Some of them even tell their partners about it, so they like to try and keep it private. So anything at all to try and help them. But also aids the longevity of the lever, prevents it from snapping. Okay? So nice, slow, gentle compressions up until full erection. Once the gentleman generates a full erection, they maintain that for 5 seconds. After a 5-second period, press the black button and the penis will become flaccid again. Okay? So every gentleman wants to be using this for 10 minutes every day for an average of 4 weeks. Okay? That 4 weeks is known as the rehab period. Alright? After a prostatectomy, some gentlemen will begin to experience atrophy of the penis. Okay? It will shrink in size purely because it's no longer being used as much as it used to. That whole rehab period is the stretching and strengthening of the fibers within the penis to try and get it back to its full genetic potential again. Using a pump will not increase the size of the penis, it will only restore a gentleman back to their genetic potential. Okay?
Sorry, did you just to interrupt you?
Sure.
How long do you hold it erect for?
5 seconds.
Only 5 seconds.
5 seconds.
Or, and repeat it to
So for 10 minutes, you're looking for 10 to 20 consecutive erections, each lasting 5 seconds.
Yeah.
Okay? The pump can also be adapted for patients who have Peyronie's disease, so curvature within the penis, and that's simply adjusted by inserting smaller cylinders within inside that, depending on the degree of curvature. Yes?
Do you have any of those here?
Smaller cylinders?
Yeah.
Yeah, I have them there down the back.
I'm very interested in that.